Hi, my name is Tara Alder with Alder Brick Healing Arts, and today I'm going to show you how you can get yourself in place on the LIBBE device to receive professional colon hydrotherapy. First, you're going to want to remove your clothes from the waist down and then hang them on the hooks provided on the wall for you. Okay, and then you're going to come over here to the table and you're going to rest your bare bottom directly on the instrument like so. Then you're going to bring your left hand and place it on the edge on the left side of the equipment. Then you're going to bring your left leg to the left side so that you have one foot resting on each ledge. And from this sitting up position, you can very easily reach your right hand over your right thigh and hold the tube. I do want you to take note that this is a one-time use only sterile disposable tube. So it is easily removable from the spout. And so your job is going to be to leave it connected to the spout. So instead of pulling it out and putting it in you, you're going to hold it firm and then lower your bottom onto it. This splash guard can remain in place while you get yourself in place. So again, from this sitting up position, you hold the tube firm. You will want to squeeze the lubricant packet so that the tip is nice and lubricated, and then dispose of it in the trash bag that's provided. Okay, and in this case, since we're just pretending, I am going to see if I can get this back on so I don't make too much of a mess here. Okay, so at this point, you're going to want to lean your upper body weight on your left elbow, but I guess you can use either side depending on what's most comfortable for you. I'm going to use my left. And this is an important step because with your upper body being supported by your left elbow, you can easily lift your bottom up, find the center opening of your bottom with the tip of the tube, and then lower onto the tube. And this is an important part. You've got to have the tube inside you past the point of those external muscles that make you want to pinch and push out. Then you can let go of the tube and rest your bottom down. At that point, you'll want to grab the sarong that we've provided. You can lower the pillow to rest underneath your neck, supporting your head. And then you're going to unfold the sarong all the way and lay it over top of you. This is going to give you privacy and warmth. Once you're in place, you can go ahead and push the call button, and that's going to invite the therapist in, and then we will come in and take you through everything step by step from there. A couple things I want to point out is it is very important that you get on to the tube 2 inches. It is measured precisely, so you cannot put it in too far. However, it's really easy to get it just barely at that center opening, but not in your body. So this is not going to be far enough. If you're lowered onto the tube this far, that's not far enough. You literally have to have your bottom and your thighs all the way up against this contoured part of the table. Okay, again, that's not far enough. It's got to be all the way up there. Maybe a little bit like going to the gyno's office where they're like a little further, a little further. But very different orifices. Anyways, if for any reason you're experiencing challenges when you go to receive that tube in your center opening, then you might want to consider using an additional lubricant. In this case, I keep these nitrous gloves handy. So if you want to put on one of these gloves, you can also access a vein toning salve that is a wax and oil base with some herbs on it. You can go ahead and then receive a little bit of the salve onto your index finger, put the lid on and put it back. The salve is intended for single dipping only. Under all circumstances, you never double dip. Most people learned that from Seinfeld. Anyways, at this point, you have lubricant on your finger. Again, you can lean your upper body weight on your elbow, and then you can use your finger to find that center opening. Now, your finger is soft and flexible and part of your body, and it can tell the difference between a fold in the skin and the actual center opening. Your finger can actually help to lubricate the inside of that opening as well as dilate that muscle and prepare it to receive the tube. So in this case, you're gonna find your bottom opening, and then once you're done with that, you immediately make a fist and you pull the glove off inside out. Before you touch anything, you don't wanna touch yourself or the sarong or anything. You take the glove off first and foremost, and then you can deposit that glove into the bag that's provided, okay? And then you can go ahead and grab the tube, lift up, and lower down onto it, gently and easily. It's supposed to rest very comfortably. It should not hurt at all in any way. If it does hurt, you want to discontinue the session, or maybe try a different angle that doesn't hurt. Sometimes if you're trying at the wrong angle, it's going to come up against resistance. So if you try at a different angle, you'll be able to receive the tube. Another thing I want to make note of is that if you forget about the elbow trick that gives you that upper body leverage and support, and you try to just hold the tube and lay back, you're kind of trying to slide. It doesn't work so well. You're very likely to want to pull the tube out to put it in you, and that's not what we're looking for. Also, if you lean on your hand, it's a lot more awkward to lift up and lower down. Some yogis might be able to do that, but average people might be challenged with that. So again, lean your body on your elbow, lift up and lower down onto it. Cover yourself for privacy and warmth. Lay back, enjoy the pillow, and push the call button. One more final tip. If you're like some people and you don't catch every single detail of my instruction, and you do pull the tube out, if you do pull the tube out, then you'll just have to put it back in, okay? Pretty simple. And then you can replace the splash guard, bring your hand over and lift up and lower down so it stays connected. All right, that's it. Thank you very much. Have a fabulous colon hydrotherapy experience. If you're concerned about anything, please consult with your physician or your healthcare provider, and talk to your colon hydrotherapist if you feel like you have any concern that you would like to discuss. Thank you. Aloha.